93-year-old gentleman, from Karimnagar, Telangana, laborer, agriculture by occupation, came with the chief complaint of swelling in the right hemiscrotum from past 2 months and dragging sensation of pain in the right hemiscrotum from past 1.5 months. History of present illness. The patient was apparently all right 2 months back when he started complaining of pain. Incidentally, when he started when he started observing a swelling in the right hemiscrotum, which was insidious in onset, progressive in nature, and attained present size of 4 into 7 centimeter. This swelling didn't have any relation with the change in position with respect to the size of the swelling. There is history of minimal intensity of dragging sensation of pain with vague discomfort and feeling of heaviness, increased with increasing size of swelling. There is no history of back pain. There is a history of right side. This is the left side. This left side testis removal through the scrotal approach 6 years back, which was infective etiology, although documents were not available as per historically. There is no history of scrotal trauma. There is no history of fever, night sweats, dysuria, increased frequency of passing urine. There is no history of noticing any abdominal mass, any swelling, any axillary or groin region swelling, or swelling opposite hemiscrotum. There is no history of cough, chest pain, or dyspnea. There is no history of suggestive of weight loss, loss of appetite, or swelling in lower limbs. Past this history and personal family, there is no patient don't have any comorbidities. There is past history of left scrotal exploration 6 years back with no documentations available. There is no significant past medical history. He is a chronic smoker, taking 2 to 3 cigarettes per day from past 60 years and is currently smoking. There is a history of alcohol consumption, 30 ml per day for past 60 years. No bladder and bowel disturbance. He is married, father of 5 children. Sleep and other bowel bladder is okay. So summarizing my case is a 93-year-old gentleman presenting with the complaints of swelling in the right hemiscrotum from past 2 months associated with heaviness, vague discomfort, pain, dragging sensation, and a past history of left hemiscrotal exploration. And there is no signs or symptoms which suggestive of distant metastasis.
Okay, ma'am. So what are the key points in your case? First thing, go back to your chief complaints.
Madam.
Yeah. So what are the key points in your case that you are interested in the first slide which you see?
Yes, madam.
So yeah, tell me.
There is a recent onset swelling in the right hemiscrotum, which a patient notes, and it has a progressive nature. It is increasing, and there is also associated increase in symptoms like pain and dragging sensation, which indirectly reflects, madam, some progressive ongoing etiology is there, and which needs further evaluation to diagnose. As per history, it looks something recent onset change with the progressive nature.
So are you interested in age of the patient?
Madam, age in this, if we go with the age, it is elderly, very elderly individual. Although the neoplastic etiology in this age group.
In other words, what I'm asking is, with the testicular swelling, does the age has any significance?
It has a significance. Usually, germ cell tumors, especially in NSGST, non-seminomatous, usually present in second decade of life. If seminoma is there, it presents in third to fourth decade of life. Spermatic seminoma presents is usually fifth decade of life. So this age group doesn't fit into a neoplastic etiology, but it is nothing a hard and fast rule. It can present in the very elderly age group.
Why you are thinking in terms of only neoplasm?
Madam, as there is no history of trauma, there is no history of any fever, constitutional symptoms. There is no any history which would suggest to me that it is an infective etiology. There is no history of any local, any infective inflammatory pathology, which will tell me or reflect me that the patient is not having any symptom which suggesting me of infective or inflammatory pathology. That's why I am thinking in terms of some neoplastic pathology going on with a recent onset.
Ma'am, I had a question. When somebody asks, just by history, on the basis of history, can we say it could be a hernia or a hydrocele as well?
There is no change in position. I have told the position. There is no positional change.
On lying down, there is no reduction in size of the swelling.
On history, it will tell it changes in while he sleeps. The height.
In other words, when you should tell the sentences properly, like through the history, though there is no clue of it being a hernia or hydrocele or an epididymoarthritis, I would like to still examine to confirm my findings. It could still be from the history. You should consider for differential diagnosis. Don't just, because we are giving surgical oncology examination, it doesn't mean every swelling in the scrotal region is a testicular tumor. Okay? Keep your mind
open.
I mean, keep your thinking wide. Okay? So, just from the history, you cannot just tell it as testicular tumor. Okay?
Okay, ma'am.
So, there might be a negative history. Why? Can it be a lymphoma? Can it be a leukemia?
It can be.
It can be, ma'am.
So, you should always think in a broad sense, okay? It can be leukemia. Testis, is it? What is testis for leukemia? So, it can still be a leukemia.
Yes.
Okay? Do hydroceles present like sometimes only with a dragging pain?
Yes, madam. It can, madam.
They will not give history of trauma.
Yes, ma'am.
So, think quite, okay? You just cannot confirm always from the history. When you're giving a single diagnosis, be careful, okay? Unless very rarely it will be a single diagnosis. Always from the at the end of your history, you should have differential diagnosis, okay?
Fine.
So, and when you are asked what is the significance of age in a testicular swelling, okay, you're thinking, see, that's what we do, okay? As students, our thinking goes only to tumor. You started with saying it is germ cell tumor, it is this one. Why not? It is an infective pathology. Why not? It's a hydrocele. Why not? It is a hernia. Okay. So, people might give so many. So, if we were a general surgery PGs, so you would think of hernia or hydrocele first.
Correct.
So, keep it in a broad sense. Okay, your thinking should be wide at the end of history. So, you're getting from your chief complaints, you're getting a clue that this swelling is of recent onset and it is presenting with dragging pain. Okay, and the very important history in this case is past history of some transscrotal orchidectomy. Is it right?
Yes, ma'am.
So we don't have any documents available. So generally these people, they're not educated. So they might give the history that they have done an orchidectomy, but we don't know the histopathology. So we should always take it with a pinch of salt when they say they did not see anything on this one. So unless document proof is there, okay?
Okay.
So yeah. So now, can you, if I ask you, what will be your differential diagnosis in order? Okay. Go to the presenting illness. So, what is the cause of pain in a testicular swelling?
Usually,
Ishwak, your name is Ishwak, no?
Yeah.
Yeah, tell me, Ishwak.
When any swelling, any pathology compresses the nerves, it causes ischemic necrosis of these sensory nerves, which due course of time results in because of weight of this mass, madam, it results in a dragging sensation. Or if if we say
which
this
is
dragging,
more common, Ishwak? Is it the weight that causes pain, or is it the nerve infiltration that causes the pain?
No, it is the it's a nerve infiltration, madam.
Are you sure? How many testicular tumors you have seen with the nerve infiltration causing pain?
Mostly
weight and stretching. Weight and stretching.
It is weight. Okay, it is weight. Most often they perceive it to be a dragging sensation, or they perceive it to be a heaviness. Okay. So yeah. So that is more common. Okay. So anyone else who can tell what is the cause of pain?
Stretching of testicular capsule, or we can say albuginia.
Yeah. Ishwak, what are the layers of
Dartos muscle, ma'am. Dartos muscle stretching.
Yeah. You tell me the layers of scrotum and layers of testis.
Madam, the scrotum layer is from outside to inside. It is skin, madam. Then it is dartos fascia. Then external spermatic fascia. Then cremasteric fascia. Then internal spermatic fascia, madam. Regarding the testes, outside to in, it is vasculosa. Then albuginia. No, sorry, it's vaginalis, tunica vaginalis, tunica albuginia, and tunica vasculosa.
Okay. So what happens in vasculosa when a testicular swelling is there?
Must be compressed, madam.
What is there in vasculosa?
It is the vasculosa contains all these vessels, feeding vessels towards the seminiferous tubules.
So it contains the vessels, right? Yes. So when a tumor starts there, or when a swelling starts there and stretches outside, so what happens to that layer? The blood vessels, there will be compromise in the pressure. So it will cause ischemia. Okay. So that is also one cause for pain. Okay. So ischemic pain is another cause for pain. Okay. Most often the pain will be due to dragging sensation or due to the gravity because of the swelling itself. Okay, size of the swelling itself. Second, it will be due to the compromise in ischemic supply. Third, it will be due to the stretching of the capsule. Okay. Fourth, it will be because of the any infiltration. Okay.
Okay.
Got it? Yeah. So relation to with change in position, does it have any significance?
Relation to change in position usually reflects, madam, benign etiology. For example, hydrocele, hernia, they usually get reduced while lying down. But it doesn't happen with other pathologies.
Can you give me one other swelling in the scrotal region which gets reduced with in lying down position apart from hernia, hydrocele?
Orchites, madam.
Sorry?
Varicocele. Varicocele, ma'am.
Varicocele. Correct. No, varicocele has grades, no? Yeah.
Yeah, madam.
So that is more common. So then why back pain, Ishwak?
Back pain in case of testicular mass, it can be an indicative of advanced malignancy. Usually, if a testicular swelling or a neoplastic lesion has a bulky lymph nodal mass in the retroperitoneum, that can press the nerves and cause back pain.
Okay. Fine. So what other tumors, what other swellings can you think of? Suppose you classify it as congenital, traumatic, inflammatory, neoplastic. Okay?
Yes, madam.
So what are your differential diagnoses for a swelling in the testicular region?
Madam,
Congenital.
Congenital hydrocele, madam.
Congenital hydrocele. Yes.
Then it can be an infective pathology, madam. Or congenital, there can be in adolescent torsion testes can present as, but
can there be hernia in infants?
Yeah, madam, hernia with hydrocele, both can be, madam.
Yeah.
Then it can be orchites, madam, epididyma orchites.
No. What about any other cause of trauma?
Trauma can cause hematoma, madam.
Hematoma.
Hematocele, ma'am.
Hematocele.
Yeah, hematocele. Then what about inflammatory?
Epididyma orchites, madam.
Epididyma orchitis.
Then it can present as neoplastic etiologies, madam.
Can anything inflammatory? Have you heard of a spermatocele?
Yes, madam.
Epididymal cyst as well.
Can it be a paratesticular mass?
It can be, madam.
So don't think of testis only. There is other things, no? So starting, you only told layers, all things. So it can be pathology in any of those things. Okay, it can be infective cause of any of those things. It can be neoplastic cause of any of those things. Okay. So what will be the neoplasms? Suppose in 93 years of age, what could be the likely causes of malignancy? What tumors do you think will come in 93 years of age? No, we may not be right, but
in extremes of age, spermatic seminoma, lymphoma can come.
Yeah, spermatocytic seminoma and lymphoma.
Metastatic to testis can also.
Metastasis.
Yeah, metastasis to testis might come. So where does the metastasis to testis come from?
Prostate, bladder.
Melanoma,
leukemia, again, same thing. Okay, it's not metastasis, but leukemia also can cause testicular swelling. Okay,
yes.
So so all this will be your differential diagnosis. Okay, next.
Yes.
And back pain, as you said, can be due to retroperitoneal lymph nodes causing compression. Okay, then
History of limb swellings, loss of weight.
Why limb swelling?
If the lymph node mass compresses IVC, it can cause limb swelling.
Okay, you think it's compression?
Yeah, madam, compression, because of compression.
Either it is due to lymph nodal mass compressing or it is due to IVC thrombosis.
Yes.
That is what you think?
Yes, ma'am.
Okay. Why fever, night sweats?
So as to rule out infective pathology.
Specifically?
Not
infective.
Night sweats, tuberculosis. Night sweats, tuberculosis,
lymphoma.
Yeah, TB also is one of the differential diagnosis. Okay?
Yes.
So, fever, night sweats is for B symptoms. Okay? Weight loss, fever, night sweats are more so for lymphoma. Why dysuria?
UTI, urinary tract infection, ma'am.
In what way it is related to testicular swelling?
Epididyma orchites related to UTIs, madam.
Okay. Anything else? You only told. No. Can it be a metastasis?
Yes, madam.
Yeah, so that also can be there. So, and what about mass abdomen?
Mass abdomen is reflecting mass in epigastrium, retroperitoneal mass arising from testicular.
So you still don't know it is hernia also. Hernial component can also be there in abdominal cavity. Okay. In inguinal ligament, inguinal region, or in the abdominal cavity. Okay. Or any retroperitoneal extension. We don't know. Okay. You should think broad.
Yes, madam.
Why neck, axillary, groin regions?
Any other nodes in the groin, madam?
So lymphomas.
Lymphomas, or sometimes this when
or
metastasis because of retrograde flow from para-aortic towards inguinal nodes.
So where do testicular tumors metastasize generally?
They go to, madam, nodes, retroperitoneal nodes, madam.
Can they go to inguinal lymph nodes?
When there is too much of bulk of lymph nodes in the retroperitoneum, they get so much so studied that it is.
In your case?
In my case, it is not there, madam.
Scrotal violation can also cause.
Scrotal violation and cause.
In your case, that is important. Okay? Though it's not on the same side, but it is important history that you should be aware of. The first thing is scrotal violation. Okay? Retrograde spread is different. Okay? That is rare. Loss of weight and loss of appetite, as I told, lymphomas, tuberculosis, as well as metastatic symptoms. Okay? So next. Has occupation got any relevance to testicular swelling, sir?
Scrotal malignancies in the chimney workers has been related to this scrotal cancer, squamous cell carcinomas.
Okay. Anything else?
As such, testicular swelling, testicular mass doesn't have any direct relationship, but no much so evidence about any particular agent that can cause testicular cancers. But occupation, just to rule out scrotal, there is a good evidence regarding scrotal malignancies.
Okay. So, anything else that I should have mentioned? Though I have mentioned there was left scrotal orchidectomy.
Cryptorchidism, history of cryptorchidism.
Any past surgery in the childhood?
Yeah. Anything else?
Family history, ma'am.
Family history.
So I should also ask for swelling in the opposite side. Okay? I'm still at the history level. Right?
Yes, ma'am.
So I should have asked for swelling in the opposite side of the testis. I should have asked for.
Opposite is, we have written, madam. Opposite is okay. Opposite. There is no history of opposite side. Only there we have not. We have not mentioned that.
Swelling. Noticing swelling in the opposite side, as well as anywhere in the groin. Okay, these things should have been written. Okay. Okay.
Madam, your voice is on. Madam, voice is breaking. Voice, madam.
Personal history is important for you. What in personal history?
Madam.
What
madam,
are the
voice is breaking, ma'am.
What are the history is important for you in terms of personal history?
Personal history, madam. Personal history is, in case of testicular swelling, is history of smoking, madam.
Okay.
Exposure, ma'am.
Bowel bladder history, frequency of maturation.
Something more important you want to know, no?
STI.
You want to think.
Sexually transmitted diseases, madam. Any history?
You are not interested in whether he is having children.
We have written that.
Leave alone 93-year-old, but I'm just telling you, history of fathering children is very important. Okay, because your treatment will have effect on fertility. Okay, leave alone 93-year-old, but you should never forget that smoking and all are common. Okay, for all the tumors, smoking, alcohol, everything is okay. Okay, past history of undescended testis, past history of any scrotal violation, and past history of any personal history of any infertility is very important. Okay, right. Next.
Ma'am, should we ask about the high risk behavior to rule out syphilis or something like that?
Yeah, you can ask about high risk behavior. Okay, but don't attack syphilis. Syphilis is not there.
Okay, ma'am. Okay. Yes, ma'am. Syphilis.
So, you can ask about high risk behavior. Okay, there is no problem in asking. Okay, but just don't tell syphilis. Okay. Some people will get offended.
Okay.
Next.
In one class, I heard they said that HIV is associated with CA testes, but I couldn't find any literature for it. Is it?
No, there is no literature. Because of immunocompromisation, these CA penis or testicular tumors are more prominently detected in those who are immunosuppressed. But there is no direct correlation as such. No studies say there is relation to HIV. Okay?
Okay.
Yeah. Next. Yeah.
And gynecologist, in negative history, should we ask
Yeah.
about
Yeah.
gynecomastia.
So be careful. Some people don't like it. Okay.
Okay.
So example Anand Raja sir. So he doesn't like telling gynecomastia. Now they'll drag into what is the tumor associated, what are the types of that particular tumor. Okay. So if you are very confident that you can answer all the questions related to gynecomastia, you tell. Okay.
Okay.
Right?
Shall we mention or not mention?
They're safe not to mention, ma. It's okay if they think, if someone thinks that has to be mentioned, it's okay that they think that you have missed it rather than like dig your own grave into that, because pathological and all will not know. Okay. They might just go into details of that particular tumors, what are types of gynecomastia, what are drugs causing gynecomastia, all these things. So better. Okay. Any other infectious causes which can cause testicular, testicular problems? Generalized infection causes, not particular to testis.
Mumps, madam?
Mumps orchitis. Then you told about HIV. Then anything else? TB. Then anything other virus? Viral orchitis? Other than mumps? What other viral orchitis?
No.
You will find out and tell me, or shall I tell?
Coxsackie and parvovirus.
Sorry?
Coxsackie and parvovirus.
Yeah. So Coxsackie, parvovirus, cytomegalovirus, these are implicated in causing orchitis. Okay. So next, move on. Sure. Yeah. Go to the examination. Okay. If you are asked to tell 5 differential diagnoses at the end of your history, how would you place them?
I will place first a testicular neoplastic pathology, then followed by hernia with hydrocele.
Okay.
Then any other infective pathology, chronic infective pathology. Although its history is very short, but he might not. There is a recurrent left side. It has happened. Now it is right side. There must be recurrent some chronic infection. But I will keep my top still neoplastic, followed by hernia and hydrocele.
Okay.
My priority.
Okay. Move on to examination.
In general examination, examined with the due consent in standing and spine position both. Performance status 1, ECOG. Height and weight is 0.6.
You're on call. On class was going on. We are discussing the things. We are exam going on. So 5 to 10 people have one group, and we are discussing case alternative.
So what you do is
There's a lot of trouble for you and
no, nothing. Since all aunties are busy helping the other auntie, that is for tomorrow event. So that's why she have to go. That's why I don't have a car. And the other car I have is my son-in-law's, which we have removed the insurance, so I cannot drive that car. Okay, thanks. Yeah, tomorrow I'm taking them to.
Uncle, we should carry some bag or maybe
No,
just your passport?
they will give you. They'll give you placenta. Yeah, good question.
It's America, so I should ask.
Yeah.
Thank you so much.
So, any problem, give me a call her, okay? All right. Bye. Don't spend all the money.
Oh, my father gave me.
Okay, good.
Father will give, but you should not spend.
25 years back, if somebody dresses like in Bangalore, which country are you from? No, nobody will ask. When I was in dental college, one engineering student, she wore a pant like you and she was walking. The whole dental college students came out to see her.
In Bangalore.
In 1970s, no.
Now, if you are not wearing like this, means you are from
Some village.
So for usually I don't wear jackets and in conferences also, but for America I especially kept 2 to 3 pieces.
Okay, there you go.
Where you were practicing?
In Cleveland, Ohio.
Cleveland, no.
I studied in Detroit, Michigan, and I did my fellowship in oncology
Where?
in Detroit.
Detroit, okay.
And then I practiced in Ohio. I was in private practice for 42 years.
Then we will get a lot of oncology knowledge from you.
Oh, medical oncology. I'm mostly medical oncology.
So medical, actually oncology comes as a unit only.
Correct. Have a seat. Okay,
Sorry,
Indian right drawing the ಅದಕ್ಕೆ ಆ ಕಡೆ ಬರ್ತಾ ಇದ್ದೀನಿ.
That's common.
Any benefit of this side steering?
No, getting used to it. See, roads are, you drive on the opposite side. So, because we are driving on the right side, being on the left side is better. So,
Okay.
Driver will be very careful.
no, it,
Left side you will take care fully, no?
You know what you get used to. What you get used to. Yeah, I used to drive in India when I come there. But since Uber came, I told my wife to sell the car. There's no need. I only come 2 months a year. So we have to have a driver who's sitting there getting paid. So I said, just no need for it.
ಇದು seat belt ಹಾಕ್ಬೇಕು.
Right, seat belt. Right. So I told them to get rid of the driver and the car. So whenever I come, I use a lot of Uber.
Now we can see the clear view of the lake.
Yeah.
Morning it was so misty.
Yes.
Gotakkirilla.
Oh, this is so beautiful. Yeah.
There's about 40 lakes around this place.
40.
Entire Bangalore you can't see 40 lakes.
No, there are big lakes.
In Bhopal is the capital where largest lake in India.
One lake is there, no? Bhopal lake.
2 lake.
One I have seen big one.
One Bada Talab, one Choda Talab. But that one lake, around that one lake, whole Bhopal is situated.
Oh, really?
Yeah.
They have a office in Bhopal, BHL. I used to go there.
It's good office.
And
Bhopal is in Madhya Pradesh.
yeah.
A little bit of Jaipur.
So Bhopal is a beautiful place, but it's not this beautiful.
I haven't traveled in
MP.
Madhya Pradesh. I've gone to Nepal, Darjeeling, New Delhi. I was in the time when I was there I finished finished my medical school and I went to there was a Bangladesh war at that time. So I went to the refugee camp to be a physician there for 3 months.
My God. So scary.
I mean, it was, I was just 40 miles from where the war was taking place.
Okay.
I was in a
Oh,
refugee
that's
camp.
really
So we were the physicians of the refugee camp.
So you were able to hear that bombs and all?
No, 40 miles.
No.
45 kilometers.
ಇಲ್ಲ 40 miles ಅಂದ್ರೆ ಜಾಸ್ತಿ ಏನಪ್ಪ 60 kilometers.
About
60 kilometers.
And we were about 4 of us. So we went there and they gave us a residency. We had to stay in a school. So we had the beds and everything made there. And we would walk to the refugee.
All of your stories can be a nice biography, Uncle. You should just tell. We should all write it up. I'm telling you, it's definitely an experience to share.
Oh yeah. So
Definitely.
I think you all should make one good book.
And then your experience of coming here, settling, it's a very big thing. All of you have got a different story.
Yes.
How you have come, how you struggled, how you struggled, how you settled here.
We came with $100 in our pocket.
And without anything, no, such a long distance you have come from India.
It was like,
And culturally it was totally different from there to here. So it is a very big challenge.
And because of you people,
you have struggled so much.
because of you people, they are getting Indians are getting respected to all over country, over world.
Physicians are well respected.
One surgical oncologist, namely Sultan Pradhan sir. He is a renowned head and neck surgeon of India. So he visited at MSKCC.
I see.
And he got some good idea about laryngeal surgeries. So because they were doing total laryngectomy for all laryngeal cancers, so because he started in India partial laryngectomies. So in MSKCC they didn't consider anything what he suggested. Then he went to India and he made his own head and neck world there. And then he published his results. Then they accepted what he was saying, I think 30-40 years before.
Yeah, it always takes time to change things. Routine, get used to it. Especially wheel turns slowly there.
Actually, they were laughing at him. This I all came to know in his oration he attended in Tata this time. He got one oration there. So his whole life story he shared there. So it was like wow. So he's also gem of the person.
Let's say left side now. Right side of that.
Okay, then ulta. That is the reason why left driving is better in this country, because ಹೋಗೋದೆಲ್ಲ right, ಬರೋದೆಲ್ಲ left. Okay, I get that.
The reason is they don't want to do anything British. So in British say "Yeti is British." So British were common. So they said we'll drive on the left side. No, we'll drive on the right side. And they said we will have everything in kilograms, and centimeters. They said no, we'll stick to pounds and miles.
Pounds and miles.
So everything, whatever British said, "Yeti is British."
Okay, we are following British.
Kilograms. So they don't change it. They want to change it. So it's very common here.
In our also there are two guidelines, what MSKCC and one is MD Anderson. So MD Anderson still say free fibula. Then MSKCC says no free fibula, ALT.
Yeah, not a big.
In maxilla reconstruction, it's like that only.
I'll be doing a little bit shopping. I'll be going. Okay.
Which
I was
one?
in,
Medicine?
I was in Cleveland, Ohio.
Okay, okay.
I was there for, I finished my fellowship. I came 50 years ago.
Yeah, that's right. Okay.
Yeah, so I finished my fellowship in MD in medical oncology.
Okay.
In Cleveland, Ohio.
Okay.
I had my own practice. I started, that is a big story. I started my own practice alone.
Okay.
Grew, I did other oncology stuff. We became a group of 4 medical oncologists. Two radiation oncologists, and I started my own cancer center. So I was there for 2 years.
Is it still running?
Yeah.
Okay.
So I gave that my partner. I was there for 2 years. So I just finished, I retired last September 22.
Oh, that's right.
I returned